Welcome to Everyday Simple Somatics, a podcast dedicated to helping you find healing through your body's natural wisdom. My name's Dr. Christine Baker, and I'll be your host. So, this is something that walks into my office all the time. The person who says, I've been in therapy for a while now, maybe 6 months, maybe 6 years, and they've done all the work, right? They've worked on their attachment style. They can name their cognitive distortions, and they understand exactly why they do the things that they do. And yet, the same thing keeps happening. They still have that same kind of panic before a meeting, or maybe that same dissociation shows up every time they talk to their parent, or maybe they still struggle with codependency and overfunctioning in their friendships. They know that they shouldn't keep doing the thing, whatever it is, and yet they struggle to stop. And I think for people that experience this, there's this little question in the back of their head of, why am I not better yet? And if that's you, I'd love to just say to you, you're not a bad client. Your therapist is not a bad therapist. You have not failed at healing. There is something real and important and nuanced happening here. And today we're going to name it and we're going to talk about what to do with it. So for those of you that don't know me, I'm Dr. Christine Baker. I am a licensed professional counselor and have been working in the field of trauma recovery for over 13 years. I am also a somatic experiencing practitioner, which just means that I am a person that believes strongly that mental health healing happens through addressing the stuck places in the body, specifically the nervous system, which is why I created this podcast. My hope is that these short episodes will offer you practical skills that you can turn into nervous system rhythms of care that become as natural as brushing your teeth every day. Because that kind of consistency is really where we start to see actual shift and change in how your nervous system is functioning. And so if that sounds interesting to you, I'd love to invite you to like or subscribe to this podcast on whatever platform you're currently watching or listening. All of those little clicks really do help other people find this information, and I so appreciate it. Okay, and speaking of things that I appreciate, we have been reading off our 5-star reviews from our different podcast apps. I want to switch over to YouTube for a second because we get a lot of great comments on YouTube as well. This comment is from @Yera Tim, and it is on the video entitled The Secret to Emotional Regulation, Your Window of Tolerance. And she says, I just discovered you and am amazed by how understandable and emotional you express and explain things. Little heart emoji. Love it, Christine. You came at such a right time. Thank you for your gentle touch and your emphasis on flexibility between states, because I believe it is the missing part for rigidly perfectionistic patterns of perceiving life. Thank you so much for this comment. I really appreciate it. And I am with you. I think that reminder of the flexibility between nervous system states, and not just that, but the mixed nervous system states that can exist, which I don't think I've talked enough about. And maybe I can even do a future episode on that. But so appreciate any comments or reviews that you guys leave. And so I just want to take the time on the podcast to actually speak to those. So thank you. Thank you. So I want to tell you about a client, and I'm doing client with quotation marks here. This is going to be a composite story. Details are kind of mushy and changed, but this pattern is one I have sat with so many times, okay? So this client came to me after working with a therapist for 7 years. She could narrate her childhood experience with the precision of a clinician. She knew all about her wounds from her mom and how they had shaped her. She had done EMDR. She had done CBT and DBT. She had read every book on the list. Very educated client. And yet she still couldn't say no to her boss. Her body would kind of lock up when her boss would ask her to do something past what was in her job description. She'd end up leaving with this assignment for work that she did not want, and with a tightness in her chest for not being able to say the words that she knew she wanted to say. And then she would just sit in her car and think, what is wrong with me? I've been going to therapy. I've been paying my therapist for 7 years. Why can I not just say no? And so that's the gap that we're going to talk about today. The gap between knowing what's going on and healing what's going on. And what I want to offer to get us started there is that there is a difference between understanding a pattern with your mind and recognizing it in your nervous system. Both are real. So I want you to hear that. This is my hope for this episode, is not to just dog on CBT and DBT. No, both are real. Neither one is fake medicine, right? Like the work on one side does not automatically translate into the work on the other side. Dr. Bessel van der Kolk says it this way in his book, The Body Keeps the Score. And I actually want to read it to you exactly as it's written because I think it's worth hearing it in his own words. So he says, no matter how much insight and understanding we develop, the rational brain is basically impotent to talk the emotional brain out of its own reality. So let that land for a second. What he is saying is that part of your brain that builds all of that insight, that has all of those conversations in therapy, that can articulate all of your patterns so clearly, that is your rational brain. Beautiful, important, needs to be a part of the conversation. But those patterns themselves, like the panic, the shutdown, the dissociation, those live in like a totally different neighborhood of the brain. Okay. They live in the emotional brain, the nervous system, the body, and the rational brain, no matter how brilliant and insightful, just can't talk this side, that emotional brain, out of those patterns. And so this is where you're going to start to hear the language of top-down or bottom-up therapies. And I want to bring in Dr. Pat Ogden, who founded sensory motor psychotherapy, into the conversation at this point. So just a quick definition, top down means that we are working from the thinking brain, this rational side, down towards the body. So, insight, narrative, reframing, understanding why is where we're starting. Bottom up therapies means that we're working from the body up towards the brain. So we're starting with things like sensation, movement, regulation skills, breath, like what is happening in my physiology right now. And so most traditional talk therapy models are going to be that top down. And like I said earlier, top down does real valuable things. It helps you make sense of your story. That's important. It helps you name what happened. That's also important. I think about advocacy in therapy. Oh my gosh, we have to name and understand what has happened to us, right? I also think it's a huge part of building that therapeutic relationship with your helping professional, which becomes a huge resource for any other work that's going to happen. So I am not here to throw talk therapy under the bus, and I don't think Pat Ogden or Bessel van der Kolk would either. I think they are both very clear that top-down work matters. And then here's the part that I think Dr. Ogden gets at so beautifully. In her model, top-down direction is, in her words, harnessed to support rather than manage sensory motor processing. So let me say that one more time. Top-down work is harnessed to support rather than manage the body's processing, meaning the insight is in service of the body's work. The understanding is like the helper, not the main event. And for trauma, which results in these patterns that are stuck deep in the physiology in the body, the bottom-up work has to be there. Otherwise, you're using the rational brain to manage a problem that doesn't live in the rational brain, which is exactly why my quote unquote client can know everything about her history and what she needs to do and still can't do it. So I want to give you a moment to feel the difference yourself. We're talking about this idea of top down being a support for bottom up. And it would be kind of silly and funny for me to not do any bottom up work in this podcast. And so we're going to practice together these two options or these two doors, because I want you to be able to feel in your physiology the difference. And if you're driving right now, just listen. You can come back and do this practice later. But if you are somewhere where you can pause for a moment, I'd love to invite you to just find a comfortable position. Maybe take a breath in through your nose, out through your mouth. Letting that exhale be a little longer than the inhale. So this first door is going to be our door of understanding. And so I want you to bring to mind a pattern in your life. So something you know about yourself, maybe something you've talked about in therapy, maybe it's like a struggle with boundaries, or maybe it's a way that you shut down in conflict. Maybe it's that you overwork or doom scroll too much. And I would invite you to not make this the most intense pattern in your life. Like, let's make it a kind of a gentle one to be curious about. And then from your thinking brain, I want you to just narrate it. to yourself out loud. Tell the story of this pattern. Tell me where it came from. Pretend I'm sitting there listening. Why does it make sense? What is it protecting you from? You know the story. You've probably told it before. So just pause the podcast and take a moment to tell it out loud now. And once you've done that, I want you to just notice what that feels like. There may be a little clarity. There may be a little bit of satisfaction of like, okay, I articulated that well. That's going to be door one, that more top-down, rational brain doing what rational brains do. Okay. Now we're going to shift our attention over to walk through door two, which is going to be more that bottom up processing. Okay. So I want you to drop the narrative entirely. Let it go. We're going to stop telling the story for a second. And instead, I want you to bring the pattern back to mind. And this time, I just want you to notice your body. Not what you think about the pattern, but what is happening inside now as we just bring the idea of that pattern into focus. What's happening in your chest right now? What's happening in your throat or your belly or your shoulders or your jaw? Where do you feel this pattern in your body? And if it's okay, see if you can just take a couple of those breaths that we talked about earlier, that inhale through the nose, exhale through the mouth with a little longer exhale, and just hang out with that place in the body where it lives. I don't have to fix it. I'm not analyzing it. I'm just noticing the sensations that are there. You might feel some tightness. You might feel some pulling in or some shrinking. You may even feel a temperature change, like heat or cold, or you may feel nothing, which is important information. Your body may have gone a little numb around this material, and that's worth knowing too. So that was door two. That's bottom up. That's your body telling the story that your mind already knows, except now you're just listening to it in a different language, right? And so here's what I want you to notice. You probably could have stayed at door one for an hour and not gotten what you got in 1 minute at door two. Not because door one is bad. It's not. Door one is doing what door one was built for, but door two opens into an entirely different room. And for the patterns that are stuck in your physiology and your nervous system, door two is the room where the work primarily needs to happen. So before we wrap up, I just want to take a second to settle. Feel your feet in your shoes. Notice where your body's being held by what you're sitting on or standing on or lying down on. Maybe even imagine any sensations that came up from door two, just like, maybe going out of your feet into the ground and seeing if you can notice a place inside that feels kind of nice to be with. Okay, so before we talk about what to do with this, I want to just take a second and say something important because I don't want anyone to walk away from this episode thinking that door one is a waste of time. I know I've kind of said that, but I just want to say it very clearly one more time. Door one is not a waste of time. Here's how door one and door two can actually work together. So the insight that you build in therapy is like the map. Your body is like the territory, right? So door one tells you what room of the house you need to walk into. It tells you, that tightness in your chest, that's the place where you learned as a kid that needing things was dangerous. Or that collapse pattern that happens with your boss, that is the place where I learned I couldn't fight back or I couldn't get away. And so I just need to collapse. That context matters. This understanding is what lets you even know where to walk in to engage door two. And when we understand it, we're able to meet that space with a little bit more compassion than maybe we would have otherwise. And so here's what that might look like in real time. So you walk through door two. You notice that tightness in your chest when you think about that pattern. And because you have done some door one work, instead of panicking or shutting down, you can say to yourself, that makes sense that my chest is getting tight right there. I know where this comes from. I'm safe right now. The bear is not in the room. And door one is supporting you to be able to connect to that safety in the present moment because you understand what's happening in the room. The insight's not running the show, but it's making the room safe enough for your body to actually let go. Without door one, Door 2 can sometimes feel a little chaotic or threatening, but without door 2, door 1 is, I think, really just kind of an articulate stuckness. But together, that integration is what Pat Ogden has been writing about for like 40 plus years. So what do we do with this? I want to be really clear about something else. I am not telling you to quit your therapist. I am not telling you that talk therapy is useless. I am telling you that if you have been doing the work and you still feel stuck in your body might be asking for a different kind of attention than the one it's been getting. And so what might integration look like here? One, maybe you could bring this podcast to your current therapist. I think a lot of therapists are trained very effectively in these primarily top-down modalities, but I think a lot of them are also open and curious to maybe integrating some somatic awareness, especially if you were to bring it in as a request. You could say something as simple as, I understand this pattern internally, but I can't seem to get it to shift into my body. Could we slow down and pay attention to what my body is doing in session as we talk about it? And let your therapist know that the understanding that you have built together is a part of what is making it even possible for you to be able to ask this question. That insight work is not getting thrown out. It is just becoming the foundation for the next layer. And I really think a good therapist can be curious about that and not threatened by it. Number 2, I think you can add body-based practices outside of session. This is where that daily rhythms thing I always talk about comes in. You don't have to have a somatic therapist to start building some somatic literacy. Your body responds to consistent, small practices, those rhythms of regulation that I'm always mentioning in my intro, right? So do a little 5 minutes of orienting or do a little 2 minutes of grounding on your lunch break. The kinds of practices that we do in this podcast, they are not in competition with your therapy. They are just giving your body the reps that it needs so that when you walk into your therapist office, there's more capacity in your nervous system to be doing the work they're asking you to do. And then number 3, if your current therapy has truly hit a ceiling and body work is not a part of the room, it may be worth exploring whether adding a somatically trained practitioner, even as an adjunct or even just for a season, could complement what you are currently doing. Not replace it, just complement it. And so before I start to wrap up, I want to take this moment to mention the Somatic Wellness Collective, because I think this episode might be hitting you some sort of way, right? So the Somatic Wellness Collective, or SWC, as I often call it, is not a replacement for therapy. Want to be super clear about that. But it is a learning community where we do build that somatic literacy together. You can take in regular education about your nervous system, practice it in real time in live classes, ask me follow-up questions in our monthly Q&As, and then apply all of the work through this beautiful integration workbook that I've created. A lot of our members are people who are in therapy and using SWC as a complement to that. It's kind of the way that they're doing the 2 doors, right? So next week, I want to talk to you about how to find a somatic therapist if that's the direction that your body is asking for. So we're going to talk about what to look for in trainings and credentials, what questions to ask in consultations, and then how to know if a certain practitioner is the right fit for you and your nervous system. And so in closing, love to always give you guys this reminder: your body has innate wisdom. All we have to do is learn how to listen to it, and that's what I'm here for. I'll see you next week.